Hello and welcome to the Mom Files, hosted by me, Brooklyn, where we cover all things that are news and issues related to moms. We're in this together, you and I. Okay, this is my first real video. I wanted to get into doing this a while ago, but I just haven't had time or the energy. And I'm sure you understand. Where the low energy comes from, okay? But we have a couple things we're going to talk about, topics that I want to cover with you guys, debates, different things like that, because I feel like there's a huge gap where moms are not really being catered to, especially on social media, and there's just not a news momcaster, but here I am. I'm a momcaster giving you the news. So a couple things I want to talk about today is the mental health crisis among moms. Okay, that's a big one. Childhood vaccines debate. That is a big one right now that, frankly, I think we need to talk about. As much as people don't want to talk about it or they want to argue about them, let's just talk, okay? Open forum. I am very open-minded and I don't really have super strong this way, that way on this. My kids are vaccinated. They didn't get the vaccinate, but I am glad now with everything coming out, at least on my part. That's up to you and your own, life, whatever. Then we're going to talk about persistent racial disparities in maternal and infant health. That's a big one. There's a lot to unpack there, and I do want to unpack it. We need to. That's what we're going to do. We're going to have hard conversations. We're going to cover hard topics. But as mothers, we are probably some of the most overlooked people, right? Women were born to be moms, and that's that, and that's great. And I love being a mom, and you love being a mom. But, there's more to it than just that. Things that aren't talking about. What's going on, right? Moms, people just stop caring as soon as we get past postpartum care. Everyone, postpartum, mama. But as soon as you get past that, get it, get gone. No one cares. Which is sad, because this is why, leading into the mental health crisis among moms. It's a big thing, Recent studies have shown a sharp decline in mothers' mental health across the entire United States. Fewer moms report excellent physical health compared to years past. This decline has been linked to broader societal pressures, ongoing economical stressors, and caregiving burdens. Okay, and I wouldn't even call them burdens. I just think with everything else piled on top of us like a mountain, it can feel like a burden, right? But no, let's talk about it. So there's the societal pressures, and then there's the economical pressures, and those two things, they coexist, right? Because society tells us as mothers, you need to be home with your kids, you need to take care of your kids, mom needs to be in the picture, mom needs to be at home, especially if you're conservative. It's huge, stay at home mom, be a stay at home mom, be with your kids. And it's just not that easy for everyone. There's some women who want a career, and then there's some women who have to have a career. And those societal pressures, they push us, right? But then the economical pressures come in where it's like, it's expensive to live right now. It's expensive to live for everyone. So at some point, we need to look at moms and understand there's a dynamic there that makes it hard. And that's what turns it into a burden, because you're trying to fill your plate up with everything else that's going on. You want to be a stay-at-home mom, you want to be with your babies, you want to play with them all day, and then on top of that, you need money to survive. So let's dig a little into this. This is a 2025 study, and I'm going to read some of it to you. School supply list, drop-off, screen time. Parents manage endless details before even getting out of bed. Add work and life responsibilities, and it's no surprise that moms, in particular, have experienced a drastic decline in mental health. The study surveyed 200,000 moms, and 89.8% of whom were age 30 and older. It found that the percentage of moms who said that they had excellent mental health declined from 38.4% in 2016 to 25.8% in 2023. Those who reported fair or poor mental health rose from 5.5 to 8.5 over the years. But this sharp drop in mental health is concerning, and more research is needed to know exactly why. That's why. That's why. Moms want these things, and they're things that we're told we're supposed to have, but in all actuality, it's literally not available for most families in America right now to just drop it, drop what you're doing, stay home. Everything's more expensive. Groceries are more expensive. Bills are more expensive. Homes are more expensive. Now they're talking about doing 50-year mortgages so you'll be in debt for the rest of your life. I mean, we're workhorses. We're work cows. Anyway, but mental health is a big deal because it impacts your parenting, it impacts your family's well-being, and your long-term health. And I have talked about this extensively on my TikTok. I have bipolar disorder. Mental health has been a struggle for me just in general. You know, I have to take mood stabilizers and things like that just to function like a normal person. So mental health is a big deal. It can really, really throw wrenches in your life. It can hurt your family. It can hurt people around you. If you got mental health things going on, you know, take care of yourself. I know it's hard because where do you find the time, right? But you will appreciate the fact that you have done that. And many moms feel unseen because most support focuses, like I said, only on postpartum and not your long-term well-being, right? They give you a parenting class, show you how to strap the baby in a car seat and send you on your way. The people around you are like, hey, what's up, girl? You're a mom now. It doesn't come that natural to everyone. I mean, it just doesn't. Me, I felt like I smoothly rolled into motherhood, but it had its challenges, and I can see that I've had other friends who, you know, haven't had it that easy. It just didn't go that easy for them. And there's a lot of stories on overwhelmed and stressed mothers, which we know. So yeah, mental health, really big. We don't need to put that on the back burner. It's going to affect your children, you, your job, your husband, your family. It's just not so good. It's just not so good. Now, into the vaccine debate. We've seen a lot of things in the news. I'm sure you have. I have, about vaccines being cut down from, I don't know, some, like, what is it, like 73 to 22 to match Sweden. I'll have to pull it up real quick right here. Let's look. Okay. Trump's vision for childhood vaccines could hurt working moms the most. Oh my gosh, here we go. You know what I'm saying? Like, these working moms, how's it going to hurt them? Let's find out. Intentionally or not, Trump is adding weight to this burden that women already carrying as a family health manager. President Donald Trump is peddling a vision for childhood vaccines that, in addition to making children susceptible to vaccine-preventable diseases for longer than they need to be, would place an extra burden on working mothers. Okay, so just want to let you know, these are some sources that I'm using. I'm not really biased either way. Right now I'm kind of trying to figure out where I even sit that way. Right now I am a centrist. I'm dead center because I have so many views this way and so many views that way. Traditionally I would say I'm conservative, but then I have other views that lean more liberal. So, you know, we're just going to discuss this unbiasedly, but I'm going to tell you what it says because it's important. This is what's going on in our country right now, and it has to do with mothers. It has to do with our children. So I think it's important to discuss it. And you know, a lot of times I can't see this debate discussed. It's arguments. It's no, you're an idiot, or no, you're an idiot. no matter which side of the aisle you're on. So let's talk about it. As mothers, let's talk about it. What's the pros and cons? What's the negatives? Where's the studies? What should we know? What do we need to know? And that's why I want to be here with you. Okay? So, says, he also suggested that parents wait until their children are 12 or older to take the hepatitis B vaccine that helps prevent liver disease. Children currently get their first Hep B shot at birth. Trump, who has no medical background, did not explain how such a lengthy delay would protect a child's health. Trump's advice, an extension of recent news conference, that's where this came from, in which he told pregnant people to tough it out instead of taking acetaminophen, the pain relief drug sold under the brand name Tylenol, immediately reeked of sexism to Jessica Calaraco. I don't know if I'm saying that correctly. Calaraco, a professor of sociology, at the University of Wisconsin-Madison, and the author of Holding It Together, How Women Became America's Safety Net. Okay, her research has examined how women are often the family health managers. I'm sure you can agree. I know, I know what the name of my son's pediatrician is, but if I asked my husband, he probably would not. And he probably would not know where the pediatrician's office is because I take them there. Same thing with our dentist. He does know where the dentist's office is, but I do all that. I schedule it, plan it, make sure the insurance is good. It's a mom thing. I don't know. Dads have a dad things and mom have mom things. This is just my thing. Anyway, intentionally or not, Trump is adding weight to this burden that women are already carrying as family health managers. Okay? The measles, mumps, rubella, the MMR combination vaccine has been in use since the 1970s. Separate individual vaccines are not available at the time. A combination MMRV shot has been on the market for about 20 years, though politicized vaccine panel recently voted to limit its use. Many younger children already get an individual varicella vaccine. Combination vaccines have several benefits, including improving families' compliance with the childhood vaccine schedule, helping ensure kids get vaccinated on time, and lowering stress about getting shots. The shots also must be shown to be safe before they are approved. Okay, so we can get into that, but it is true. We're adding things to mom's plate. We're taking things off mom's plate, but I mean, what do we do, right? We've been doing these things for so long, and also it is kind of weird to think because I'm vaccinated. I actually got vaccinated twice on accident because I got all my childhood vaccines and then I joined the military. When I turned 18, I was still technically a child, so they gave me all my childhood vaccines again. So I've been dosed up with vaccines, and I have got the vaccine with my second follow-up because of the military. That one, I just, it's not that I didn't think it was effective. It's just that I didn't think it was studied enough, and I still don't. I still think it needs more studying. A lot of these vaccines were studied for years. For years, okay? It's not that I'm against them. I just believe in safety. It's the same thing with food, same thing with medicine, drugs, vaccines. Everything needs to be studied and tested. At this point, I don't know what's good or bad for us, me, you, our children, red 40, yellow 5. I don't know. I'm not a professional at that. I'm just a commentator. I'm commentating on these societal pressures and difficult things that we find it hard to talk about because people ostracize, and if you don't stand with me, you're an idiot. If you do stand with me, you're an idiot to them. So it doesn't really matter. No matter what you do say or think, someone's gonna have a problem with it. So at some point we have to just push past that and say what we want to say, and then push on. I don't really know. But anyway, vaccine policy directly affects kids' health, school attendance, and family decision making. Moms often take the lead on healthcare decision in families. And what does that mean? What does that mean for us? How is that going to change the way we do things? It's certain schools are going to require certain things. Different states are taking different things. I hear Florida is trying to get rid of the vaccine schedule altogether. And then there's a real possibility of like diseases, right? Like polio and stuff. We don't want that. We don't want that. So, we were trying to model our... Okay. We were trying to model our vaccine policy on Denmark. The health secretary, Robert F. Kennedy Jr., a longtime vaccine critic, has made it clear he thinks American children get too many vaccines, which we know, we kind of discussed that. And earlier this month, President Trump issued a memorandum directing Kennedy and the acting director of the CDC to align the U.S. with best practices on childhood vaccine recommendations from peer nations. And it specifically mentioned Denmark. This could mean fewer shots against fewer diseases, but critics say you can't simply adopt another country's vaccine schedule in the U.S., which has a very different population and different health risks. That is so true, okay? There is an ocean separating us. There is an ocean separating us. If we even think back to like when colonizers came over to America, there was sickness, right? They came from another continent over here. And these people were exposed to things they've never been exposed to. So to model our schedule off of another country's is kind of... We have different exposure risks and stuff like that. It doesn't seem like the best thing. Like, I mean, what is Mexico's? What does Canada's schedule look like? They're on the same continent with us. They have the same exposure risks as us. Do theirs look that much different? I'll have to do some research on that and get back to y'all. But yeah, it's like fitting a square peg in a round hole when our goal is to prevent disease. And that's from Josh McHon, Associate Director for Global and Public Health Policy at KFF. Denmark recommends routinely vaccinating all children against just 10 diseases. In the U.S., the immunization schedule calls for routine universal vaccine against 16 diseases. It was 17 until last week, when the Centers for Disease Control and Prevention officially dropped the recommendation to vaccinate all newborns against hepatitis B. But Denmark has created its immunization schedule in a very different context than that of the U.S. Alright. I mean, yeah, it's like comparing a cruise ship to a kayak. That's kind of funny. But yeah, different populations, different health system. It makes sense. Denmark's population is about 6 million people, roughly that of Wisconsin, and compared to the U.S., which is more than 343 million people. And Denmark also lacks the racial and ethnic diversity and wide income disparities that are prevalent in the U.S. Denmark also has highly unified health system with national health registry that basically tracks everyone from birth to death. So lots of stuff going on there. And that's true. Like, we have a lot more people in this country. People from all over the world. People travel here from all over the world. It's just, there's a lot of exposure risks. Do I think that maybe we can look into it? Yeah. I always think we should look into it. Study, do all the studies. But to just rule it out based on an opinion is kind of crazy. That's my opinion. What's your opinion? Drop it in the comments below. I would love to hear your opinion on this, because every time I hear an opinion on this, it just turns to screaming, which I hate. There's just, if you can't have a conversation, you're just not worth my time, or really anyone's time, to be honest. Okay, this is a big one, and I think it's important to talk about because it's true. It's very, very true that this is something that happens. We know this, but persistent racial disparities in maternal and infant health. Okay. New data highlights ongoing racial and ethnic disparities in maternal and infant outcomes in the U.S., including higher infant mortality rates in some populations. Okay. Stark racial disparities in maternal and infant health in the U.S. have persisted for decades despite continued advancement in medical care. Compared to other high-income countries, the U.S. remains the country with the highest rate of maternal deaths. That's insane. That right there alone is insane, that the U.S. has the highest rate of maternal deaths. The disproportionate impact of the COVID-19 pandemic on people of color brought increased attention to health disparities, including the long-standing inequities in maternal and infant health. Subsequently, the overturning of Roe v. Wade, growing barriers to abortion, cuts to staff and programs within the United States Health Department and Human Services, and the passage of the 2025 Tax and Budget Law all have the potential to further widen the existing disparities in maternal health. Okay, this brief provides an overview of racial disparities for selected measures of maternal and infant health, discusses the factors that drive these disparities, and provides an overview of policy changes that may impact them. So I want to talk about them, okay? Large racial disparities in maternal and infant health outcomes persist. Pregnancy-related mortality rates among Black women are over 3 times higher than the rate for white women, 49.4% versus 14.9 per 100,000. I mean, and the Black population is significantly less than the white population in the United States, and that's a fact. So showing the data here with a lower population, but then being 3 times higher, something's wrong there. We can all agree on that. Something's wrong. Black, American Indian, or Alaska Native, and Native Hawaiian or Pacific Islander women who also have higher shares of preterm birth, low birth weight births, or births for which they received late or no prenatal care compared to white women. What the fuck? Infants born to Black or Pacific Islander or Hawaiian or Pacific Islander people have markedly higher mortality rates than those born to white people. Why? Where are we failing in our medical system? I feel like all the medical system does is fail mothers. But this is just redonkulous. Like this is not okay. And you know, what do we do about it? What as mothers can we do to safeguard these experiences and ensure that all mothers are having the same experience when they give birth, and that they don't have to fear dying because of race? I mean, let's be honest here. The numbers show that. That is a fact. Maternal and infant death disparities reflect broader underlying social and economic inequities that are rooted in racism and discrimination. Differences in health insurance coverage and access to care play a role in driving worse maternal and infant health outcomes for people of color. However, inequities in broader social and economical factors include income, are primary drivers for maternal and infant health disparities. Moreover, the persistence of disparities in maternal health across income and education levels points to the importance of addressing the role of racism and discrimination as part of efforts to improve health or advance equity. Okay? Recent actions by the Trump administration and Congress reflect a shift away from prioritizing maternal and infant health equity and may contribute to widening disparities, which is so sad because this has been a problem forever. It has been a problem forever. I knew about this before I even did the research to go in here and talk about it, but it's something that needs to be talked about. It's something that needs to be talked about, okay? Healthcare in a nutshell is just a disaster. It's a disaster. Several key programs that historically supported expanding access to care and services and efforts to address racial disparities, such as diversifying the healthcare workforce and enhancing data collection and reporting, now face funding cuts or elimination. Other recent federal program and budget cutbacks include the reduction and elimination of the DEI initiatives, may undermine efforts to improve disparities in maternal and infant health outcomes. Moreover, the 2025 tax and budget law is anticipated to lead to large coverage losses. Ugh. I hate it. I just hate this. And I want to point this out and talk about it because people don't want to talk about things that make them uncomfy, okay? I get it. I don't like talking about things that make me uncomfy. But it needs to be talked about, and it's sad that we as mothers, you know, a lot of times we take the back seat. We're the quiet ones. We're submissive or whatever. No, we need to stand up for what's right. Not just as mothers, but as American mothers. And as mothers who want our children to live in a world where they can be cohesive with each other no matter what their race is, right? And that goes down to the foundational point of becoming a mother. Babies and mothers should be safe, feel comfortable, and feel like they have the same amount of health care around them when they're trying to give birth, and not have to fear that they will have to be a statistic, okay? They don't need to feel that they will need to be a statistic when they're trying to go give birth. And it's proven right here, right? We've all said it. The population of blacks in America is lower than whites. But the mortality rate for blacks is significantly higher than whites. That doesn't make sense, okay? It doesn't make sense. The numbers don't make sense. Okay, in 2023, approximately 676 women died in the U.S. from causes related to or worsened by pregnancy. This is a decrease from 793 maternal deaths in 2022. Pregnancy-related deaths are deaths that occur within 1 year of pregnancy. The pregnancy-related mortality rate decreased among white and Hispanic women, while there was no significant changes for Asian or black women. Approximately 1 in 5, 20% deaths occurred during pregnancy, nearly 1/4, 23%, occur during labor or within the first week postpartum, and more than half, 57%, occur 1 week to 1 year postpartum. Underscoring that the importance of access to health care beyond the period of pregnancy, recent data has shown more than 8 out of 10, 87% pregnancy-related deaths are preventable. That 87% of deaths related to pregnancy are preventable. Okay? So, health insurance has a lot to do with this, right? I got a 6-week checkup after I had my baby, and that was it. Nobody reached out to me. Nobody cared about anything I had going on. Hey, you feeling good? Yeah, okay, great. That was it. That's what I mean. Past maternal health care, there's nothing left. Do you know that most countries have women go to pelvic floor therapy after they give birth, and insurance covers that? It's like a standard practice at most places in the world. In the US, it doesn't. Most moms are out here peeing their pants when they sneeze and cough because the insurance company is not going to tell you that you are entitled to pelvic floor therapy after you have a baby. Ask for it because you're entitled to it. You are entitled to pelvic floor therapy after you have a baby, and because American women are not being afforded that opportunity or even told that it is an option for them is the reason why I can't jump on a trampoline and sneeze. I went to pelvic floor therapy after I had my second son. I'm thankful I did. I don't have to wear a diaper on the trampoline anymore or when I have a sneeze because I went to pelvic floor therapy. So if you are pregnant or planning on becoming pregnant, take your hiney in there to your OBGYN and tell them that you want pelvic floor therapy, physical therapy, so that the muscles down there hold your urine in your bladder, okay? As of 2023, black people are more than 3 times as likely as white people to experience a pregnancy-related death. We talked about that already. The rate for Hispanic and Asian people is lower compared to that of white people. Okay? 12.3 and 10.7 versus 14.9 deaths per 100,000 live births. Data from 2023 were insufficient to identify mortality among certain women. However, earlier data from 2021 shows the same rates, okay? This is crazy. And I'm going to link my sources in the video, so I'll show you this. This is kff.org. This whole article's here. I'm just dumbfounded that it's a conversation we have to have. That it's something moms have to worry about when they're going in to have children, if they're gonna walk back out of there or even walk out with the baby. Okay, that's a fear every single mom has, but to know that the numbers are against you, appalling. Okay, you and I can probably both agree on that. Okay, so let's talk about parents and social media. Oh, here I am, a parent on social media. But social media and AI has created a wormhole of hell for parents. And I mean that sincerity. I have a 3-year-old and a 5-year-old, and the internet is a dangerous place, even for you and I. Like, I see things that I'm like, man, I could have really went without seeing that, but here I am seeing it, and I wish I didn't. You know? Like, I mean, I wish I didn't see that. Our kids are exposed to what's on the internet too. If it's something you can see, it's something they can stumble upon too. So giving your children like full open access to the internet, to me, is irresponsible. Irresponsible if you want to ensure that they, you know, I don't even know what to say. Like, just to ensure that they're not having to be traumatized by some of the things that people put on the internet just to be assholes, to be honest. Sorry, I have a bad vocabulary, but I mean, what do you expect? You know, whatever. But the internet, yeah, it's dangerous, man. People are out here taking kids' faces and putting them on all kinds of different disgusting things. Just like, I have a big platform on TikTok. And I used to post my kids when it was real small, when I had a couple thousand followers. I didn't think anything of it, you know, just a cute mom posting my kids. And then I had a video go viral of me and my son cuddling, and it got a lot of saves, like 20,000 saves. And I was like, what the hell? Like, this is just a video that I don't understand why people are saving. Are they coming back to watch this? It had a lot of shares. I was just like, you know, this is really odd. I don't want this. And then when all the Jacqueline and Ren stuff came out, I was like, see, this is the dangers. This is the dangers, because a lot of you, I know, are posting your kids in the hopes that it's just a simple little thing. You're just so cute. It's a cute little moment. But there are people out here that are exploiting their children. This has been a problem, okay? This has been a problem forever. Not just right now, not just social media, right? They've been doing it on TV, Nickelodeon, for years. Kids are out here, right? They're not having a childhood. They're on TV. It's the same thing for these influencers who build their content around their kids. Solely around their kids. Can you imagine? I'm just trying to play outside, and this lady's got me over here saying, post for the video, post for the video. Do this, do that. Say this, say that. Your kids are not actors. You might get paid for your content, but your kids don't. I am glad that they're finally making states that are making laws that parents have to pay their children when they're making buku bucks off of their faces. I think that is fair. I think it's fair. If you're going to use them. I mean, but I don't think you should. I don't think it's morally right. I am a mom content creator. People know that I'm a mom. I talk about struggles of motherhood. I talk about my kids, but you won't see my kids' faces in my content. I really, really, really try to shield them from my content and my larger platforms, just because, I mean, I would do some brutal things for my kids, right? And I don't want any of these people in my path, because it will be a hellish day in hell for them if anyone ever threatens or even makes it seem like they would harm my child. They will face the full wrath of me. And I'm mentally unwell sometimes, right? But I'm sure you all agree, right? You wouldn't want some random weirdo recording your child out in public. It would make you uncomfortable, right? So you do it for them. So you record them and put them on the internet for them. You see how it correlates? And I'm not trying to shame anyone, because a lot of people may just not be aware of the risk. But if you have a large platform and your content is based solely around your children, you need a reality check. There's got to be something in your personality that is interesting enough to post about it, that it doesn't have to be your children in compromising positions. Sorry, I said what I said and I meant it. Take me down. I don't know. But those are a couple things I want to talk about, and I want to hear your thoughts on them. I mean, mental health in mothers is struggling these days. Vaccines, I mean, the world's changing, but should it be? Who knows? I don't know. I mean, to me, it just feels weird. Racial disparities in maternal and infant health. Guys, we need to prioritize health. I'm kind of confused. I hear people saying, we need more babies, we need more population, we need to decrease the population. What do you want? Do you want women to have babies that are safe, in safe environments? Or do you want women to continue to choose not to have children for a lot of different reasons, right? That's their own personal choice. I chose to have children, but other women choose every day not to. And there's reasons why, right? I mean, there's a lot of stuff that you take onto your plate when you become a mom. Mental health loads, you know, you're taking on school, you're taking on a lifelong commitment. A lifelong commitment when you have a child. That's just part of it. It just is. But women should never be afraid that they will be a statistic when they walk into a hospital because of the color of their skin when they're trying to have a child and bring life into this world. Healthcare should, treat people the same. We should all have the same safety net when we walk into a hospital to know, man, I hope I don't get wheeled out of here to the morgue. I hope that I can safely birth my child and go home and have a happy life with my baby, because the people who are working on me, I trust. I trust that they'll get the job done the way it's supposed to be done. I trust that, right? And then we talked about parents and social media. I mean, like I feel like I said everything that needs to be said there. I really do. But in case you didn't hear it, don't exploit your children on the internet. Don't exploit your children on the internet. If you don't want someone recording your child in public spaces because you're worried about what they will do with that footage, don't provide it for them for free on the internet. Don't. At the very least, cover your children's faces. Protect their identities. They are your pride and joy. They are your life, right? The last thing we want to do is have a predator obsessed with a child on the internet. People are crazy. People are insane. We don't want to make ourselves or our children targets of insanos. Okay? Not now, not never. But anyway, thank you so much for coming here to my video and talking about news and issues that moms like you and I need to discuss, right? Please subscribe to my channel and like the video if you want to see more like it. I'm going to continue to create some videos. I just got my vlogging set up. This mic is not connected to my camera, so if the audio is not crisp and clear, this is actually set up to my computer. recording it for my podcast, The Mom Files, which is available on all major platforms like Apple Music, Spotify, and YouTube. You're here, ain't ya? Anyway, I hope you guys have a great night, and I hope that you have a fantastic Happy New Year, and I hope your Christmas was great, and I just hope everything about you is great. I just hope you're great, right? With all my love, thank you so much. Catch me over on TikTok at BMM993 or on Instagram at MomLifeWithBrooklyn. I look forward to seeing you again in my upcoming episodes while we talk about other news stories that break that may affect us in our motherhood journey or affect our children, which is not something that mothers are going to stand for, right? We don't want things negatively impacting our children. So hopefully I have some good stories for you soon. All right? Y'all have a wonderful night, or a wonderful whatever part of the day you're in. All right, see you later.